Hi everyone, my name is Shubhi Pathak and thank you for attending my presentation titled Changing Nicotine and Tobacco Use in Rural Areas by Training Oral Health Specialists. So I'm really excited to share this bit of work with you today. So for some background, the Rural Health Initiative is a 5-year CDC-funded initiative supported by Pennsylvania Department of Health and specifically the Division of Tobacco Prevention and Control. So this initiative is focused on increasing tobacco and nicotine cessation and treatment services to rural and low socioeconomic status populations through encounters with their dental providers. And for this presentation, we will be focusing on the specific training that's provided to oral health providers. And so basically, there's a state-sponsored training, Every Smoker, Every Time, that's offered to all types of healthcare providers. And once they finish this, they're eligible to be on a registry and they can bill Medicaid for tobacco cessation counseling that they provide. So dental health providers specifically are encouraged to complete an additional training, which is the Integrating Nicotine Dependence Treatment with Oral Health Training. And in this training, there is a pre and post test. And these pre and post test questions, they include questions about providers' readiness to provide nicotine cessation counseling as well as to bill Medicaid for it. And then about 6 months after this training takes place, providers are sent a follow-up survey to determine whether they have implemented these services and to assess any potential barriers that were faced along the way. So for the results of the readiness assessment, these numbers are as of September 2022, when about 905 providers had participated in INDTOH training. And providers were asked about their readiness to provide cessation counseling and to bill for that service on a 4-point scale that went from not at all prepared, somewhat prepared, moderately prepared, and extremely prepared. And the chart below shows the percent of providers at pre-test and post-test who responded that they were moderately or extremely prepared to provide counseling and billing services. And so for counseling, we can see that at pre-test, 39% of providers felt prepared to provide cessation counseling versus at post-test, 91% of providers chose that they were moderately or extremely prepared to provide cessation counseling. And for billing, we see that at pre-test, 24% of providers responded that they were moderately or extremely prepared to bill a Medicaid for these services, while by post-test, 80% of providers now felt moderately or extremely prepared to bill. And then for the 6-month follow-up survey, these numbers are from providers who completed the training between July 2021 and March 2022, so they were included in the first round of the follow-up survey. We received a total of 32 responses, and out of those, we looked at who had not already been providing these services prior to the training, and that was 27 of the 32. Out of these 27, 18 providers now currently provide nicotine cessation counseling services, so a bit over half. And then out of these 18 who do provide the services, currently 10 bill for Medicaid. So in conclusion, by training oral health providers in nicotine cessation counseling, states can increase usage of cessation resources in rural communities. And currently data collection is ongoing to ensure that providers are integrating the services into their practices and to identify any additional support that they may need. Thank you so much for listening to my presentation. If you have any more questions, you can contact me at spatek@phnc.org. And for those of you who are just listening to the presentation, the spelling of that is S as in Sam, P as in Peter, A as in Apple, T as in Tom, H as in Harry, A as in Apple, K as in Kite, at P as in Peter, H as in Harry, M as in Meerkat, C as in Crocodile, .org.